Hepatitis by Brandy O'Neill, Cara Hammond, and Elizabeth Critelli. What is hepatitis? Hepatitis refers to an inflammatory condition of the liver. It's commonly caused by a viral infection, but there are other possible causes of hepatitis. These include autoimmune hepatitis and hepatitis that occurs as a secondary result from drugs, alcohol, medications, and toxins. Autoimmune hepatitis is a disease that occurs when your body makes antibodies against your liver tissue. Viral infections of the liver that are classified as hepatitis include hepatitis A, B, C, D, and E. Hepatitis A is a milder version of the disease, and hepatitis C and D are more severe. Hepatitis A is commonly caused by consuming food or water contaminated by feces from a person who is infected with hepatitis A. Hepatitis B is transmitted through contact with infected body fluids such as blood, saliva, or semen. Hepatitis C is transmitted through direct contact with infected body fluids, typically through injection, drug use, or sexual contact. Hepatitis D is very uncommon in the United States and is contracted through puncture wounds or contact with infected blood. Hepatitis E is waterborne and is contracted by ingesting fecal matter. It's found in areas with poor sanitation and is uncommon in the United States. These forms of hepatitis can be either acute or chronic. Types B and C usually become chronic. Excessive alcohol consumption causes the liver to swell and become inflamed. Other toxic causes include overuse of medication or exposure to poisons. Liver damage is initiated by cytotoxic chitosines and natural killer cells that cause lysis of the infected liver cells called hepatocytes. This causes an inflammation response that can obstruct bile flow and cause fibrosis that can lead to cirrhosis and possible liver failure. Some chronic forms of hepatitis are asymptomatic at first, such as with hepatitis B and C. In acute hepatitis, there are clinical manifestations such as fatigue, flu-like symptoms like nausea, vomiting, fever, and headache, constipation or diarrhea. Excess bilirubin is excreted through the kidneys and causes dark urine. Inflammation or obstruction of the bile ducts means that bilirubin cannot flow out of the liver and causes pale stool. There's also abdominal pain in the upper right quadrant, loss of appetite, unexplained weight loss. There can also be yellow skin and eyes, which may be signs of jaundice. Jaundice is caused by a problem with bilirubin metabolism. Intense itching, known as pruritus, occurs because of the accumulation of bile salts beneath the skin. A physical assessment can detect pain or tenderness in the abdomen. Blood tests detect the presence of hepatitis. Virus antibodies and antigen in the blood will confirm which virus is the cause. Blood samples can also be used to determine how efficiently the liver works to clear blood, waste, protein, and enzymes. Higher liver enzymes may indicate that the liver is stressed or damaged. An ultrasound can be used to reveal an enlarged liver or liver damage. A liver biopsy doesn't require surgery and determines if an infection or inflammation is present or if liver damage has occurred.
Collaborative care for hepatitis. Rest is very important in the treatment of hepatitis. Patients should be told to rest according to their level of fatigue. Rest is important because it reduces the metabolic demands on the liver and promotes cell regeneration. It is also possible that complete bed rest may be necessary while the patient is symptomatic. IV fluid and electrolyte replacement is very important if indicated. This may be necessary to keep the patient hydrated and keep electrolytes balanced if fluid and electrolytes are being lost through vomiting, diarrhea, increased respirations, or diaphoresis. Patients should be encouraged to eat frequent, small, high-calorie, low-fat, high-protein meals. This is important because a patient with hepatitis may have a decreased appetite, so eating small, frequent, high-calorie, dense foods would help to make sure that they are getting critical nutrients necessary for healing. It is also very important for the patient to eat high-protein foods. Protein is important for fighting the infection and healing damaged liver cells. It is critical for the hepatitis patient to avoid the intake of alcohol and drugs that are detoxified by the liver. For a liver that is already under stress, placing the liver under this burden could ultimately lead to permanent liver damage. Drug treatment for hepatitis B has not been shown to eradicate the virus and has a limited long-term efficacy with many adverse side effects. The first-line therapy for hepatitis B is pegylated interferon, entecavir or tenofovir. This drug therapy is focused on decreasing the viral load, liver enzyme levels, the rate of disease progression, and the rate of drug-resistant hepatitis B virus. It is also recommended that all patients should be vaccinated with the hepatitis A vaccine to prevent future infection with the hepatitis A virus. If you know you've been exposed to the hepatitis B virus and you haven't been vaccinated or aren't sure whether you've been vaccinated or whether you responded to the vaccination, receiving an injection of hepatitis B immune globulin within 12 hours of coming into contact with the virus may help protect you from developing hepatitis B. Otherwise, you will develop naturally acquired active immunity to the virus, and receiving the vaccine would not be necessary. Treatment of hepatitis C virus with long-acting injectable interferons, such as PEG interferon alpha 2A, in combination with the oral antiviral ribavirin, may induce a sustained response of undetectable virus levels in about 41 to 50% of people with genotype 1 and 70 to 80% of people with genotypes 2 and 3. There are recently FDA-approved direct-acting antiviral agents for those patients with chronic hepatitis C, including boceprevir and telaprevir, and are used in addition to pegylated interferon and ribavirin to improve viral response and clearance. Nursing diagnoses that would be appropriate for patients diagnosed with hepatitis would include imbalanced nutrition, less than body requirements related to the effects of liver dysfunction. A liver that is fighting infection is requiring a much greater metabolic demand, thus causing a greater need for nutrition. If these metabolic demands are not met, there will be a loss of weight. Deficient fluid volume related to nausea and vomiting, diarrhea, increased respirations, or diaphoresis. Fluid replacement may be necessary if the patient is losing excess fluids through vomiting, diarrhea, increased respirations, or diaphoresis caused by fever. Activity intolerance related to anorexia and liver dysfunction. A patient with hepatitis will fatigue much easier because of fever and the metabolic demands that the body is making to fight the disease. So therefore, the patient will have less tolerance of activity. And deficient knowledge related to transmission. There are ways that a person can decrease their risk of acquiring hepatitis. Some of these include proper hand washing, proper personal hygiene, protected sexual contact, and not sharing needles if the patient is an IV drug user.
One of the most common complications of chronic hepatitis is fibrosis. Fibrosis is a type of scarring of the liver. The liver is damaged by constant inflammation and creates scar tissue to repair itself. Unfortunately, this scar tissue keeps the liver from working as it once did. The good news is that if fibrosis is controlled in time and limited to a small part of the liver, the rest of the organ can work harder and keep up with the liver's functions. When fibrosis becomes extensive, doctors describe this as cirrhosis. Cirrhosis of the liver. Hepatitis C and alcoholic hepatitis are two very common causes of cirrhosis, though there are many others. Cancer of the liver. One of the complications of cirrhosis is liver cancer, and there are usually two types. Hepatocellular carcinoma is a type of cancer that affects the liver cells. The other type is cholangiocar carcinoma, which affects the bile ducts. Liver failure. Liver failure is a serious but uncommon complication of hepatitis. Doctors use different terms to describe variations of liver failure, such as fulminant liver failure, fulminant hepatic failure, or acute liver failure. Basically, the liver no longer functions, and this leads to the body shutting down and eventually death. There are many specific causes of liver failure, but in general, failure results when the liver is so damaged that it's unable to keep up with the body's needs. Glomerulonephritis is a complicated disorder of the kidneys caused by inflammation and is seen in chronic hepatitis B, hepatitis C infections. Cryoglobulinemia is seen in chronic hepatitis B and hepatitis C infections. Cryoglobulinemia is an uncommon disease caused by an abnormal cluster of certain types of protein that blocks small blood vessels, leading to circulation problems. Hepatic encephalopathy. Severe loss of liver function such as liver failure can lead to inflammation in the brain called encephalopathy. This causes mental problems like confusion and can lead to coma. Advanced hepatic encephalopathy is a serious condition and is usually fatal. Portal hypertension. One of the liver's most important jobs is to filter blood. However, cirrhosis and other problems can interfere with the liver's portal circulation system. When this portal system is blocked, blood can't return to the liver from the digestive system, and pressure increases called portal hypertension. This is a serious complication and can be fatal. Porphyria. Porphyria is a group of diseases caused by problems processing important chemicals in the body called porphyrins. One type called porphyria cutanea tarda leads to a blistering of the hands and face and is a rare complication of chronic hepatitis C infection. Viral co-infection. A challenging complication of hepatitis is the possibility of having two viral infections at the same time. Hepatitis doesn't cause the second infection, but it does make it more difficult for the immune system to successfully attack other viruses. A common co-infection with hepatitis is a human immunodeficiency virus known as HIV. Because of this, it is especially important for someone with hepatitis to take precautions against HIV infection.